Happy International Women's Day to all the ladies out there. This video is for you. In this video, I'm going to give you a short talk about dysmenorrhea, which is one of the most common cause of chronic pain in women worldwide. Around 90 to 95% of women experience pelvic pain during their menstruation. This happens during the first 2 days of their period, and this pelvic pain can even radiate to the lower back and down to the legs. There are other associated signs and symptoms that can come with it, like headache, nausea and vomiting, and other GI symptoms such as diarrhea, constipation, and even bloating. There are two classifications of dysmenorrhea. First is the primary dysmenorrhea, which is the most common one, and then the secondary dysmenorrhea. In primary dysmenorrhea, what happens is our body secretes prostaglandins. These are chemicals that are naturally occurring in our body that mimics, or they have hormone-like effect in our system. So they trigger uterine contraction, and when the uterus contract, they also constrict the blood vessels going to the lining of the uterus called the endometrium. And the endometrium, because of ischemia or lack of blood supply, the lining of endometrium will die and shed off, and due to constant contraction of the uterus, these dead tissues will be squeezed out of the vagina. There are home remedies that you can do to relieve this menstrual cramp. One is to apply heat on the pelvic area or on the lower abdomen. You can use heat pads or hot water bottles. You can roll them on the abdomen to relieve the pain. You can also elevate your feet or your legs. You can put pillows under your knees to increase the pressure down in the lower abdomen and also increase the blood supply going to the uterus. You can also add banana to your diet because banana is rich in magnesium and vitamin B12 that relaxes the smooth muscles. They say chamomile tea is also good because it has anti-inflammatory property. And of course, you do regular exercise. And if these home remedies won't work, you can also take pain medications like the non-steroidal anti-inflammatory drugs like the ibuprofens. But if the pain is very debilitating, it's so severe that you cannot perform your daily activity, you cannot go to work or school, I advise that you go and consult to your doctor and your OB-gynecologist just to rule out secondary causes of dysmenorrhea like endometriosis, uterine fibroids, or myoma, because this you might need OCPs or hormonal therapy or even surgery. So that ends this short video, guys. I hope you've learned from this. Please don't forget to share it to your friends and family, and don't forget to subscribe to my YouTube channel. I'll see you again on my next video.